Hello, my name is Robert Pollock, and this is clinical statement number 2 for the spring 2019 semester. My current clinical site is Indiana State men's basketball, and my current preceptor is Connor Burton. Over the last week or so, last 10 days or so, I've completed 33 and a half hours and attempted the SIP 4.1, which is the diagnosis, evaluation, treatment, and then modality parameter CIP. Within the last 10 weeks or 10 days, I've continued to add to my honors thesis, which I will touch upon in this reflection, and I've had two meaningful either observations or conversations with Connor about athletic training services in collegiate and professional settings, which I will touch upon later. So first to start upon is the honors thesis. So again, just as a recap, I have been documenting services in a separate notebook to kind of give the general topics of things that have been that we have as an athletic training team given to patients. So to kind of give an update on the total, we are around $17,000. And again, if you remembering that my preceptor after tuition waiver is around $12,000. We have paid for his stuff and more than likely his tuition waiver within about a 6-week period of collection. So again, that's just really crazy to think about, is that the amount of service we provided is close to what someone would be paid as a GA plus their tuition waiver. Obviously the tuition waiver will vary based on program, but just generalizing, that's a very, very close to what the entire payment plan would be for a graduate assistant at Indiana State. So, to touch upon some of the relevant clinical experience that I've had in the last couple days, one of the most meaningful ones for me was that I got to witness a steroid injection at the Holman Center. So 2 players had opted to receive this injection after kind of recurrent symptoms that had not gotten better through conservative treatment, strengthening, stretching, the usual progression for their therapeutic activity. And we're now seeking Dr. Smerek's help to kind of alleviate the pain and return them to full activity in one case, and then just alleviate symptomology for them while they were participating in the other case. It was really interesting because kind of the way that Dr. Smerek does it is there's a numbing spray that he, after he cleans the site, he uses to kind of, for lack of a better term, numb the area, and then injects into that site. So in both cases, there's 2 very similar procedures. In one case, the patient stated that completely alleviated the pain immediately, but still felt some of the tension that he had felt in the Achilles area, which Dr. Smerek kind of told him that wouldn't go away with the pain, or wouldn't go away with just the shot, the continuing to do rehab, which he sometimes chooses not to, which is always fun. Just to continue doing rehab and continue working on our conservative plan of care, and eventually the tendon will kind of go back to where it was. Just as a background, this patient had spent 2 to 2.5 weeks in a boot post grade 2 ankle sprain, lateral ankle sprain. So he'd been kind of hobbled for a while and is kind of continuing to say that he really doesn't feel that he's as explosive, which we keep assuring him that that's normal, but he's one of those athletes or patients that doesn't feel really comfortable unless he's 100%. So kind of managing his plan of care has been to just assure him that like this is a normal step in the rehabilitation process and that everything he's feeling is normal. Not necessarily the best for the coaching staff because we can't progress him unless he feels comfortable, and they want him back immediately. So there's has been a very interesting struggle the last couple weeks for athletic training staff and then coaching staff to kind of see eye to eye. And then the other thing that we talked about that was really a meaningful debrief was between me and Connor, and it was really just about skill decay in the athletic training setting and the most meaningful way to practice those skills. So I think one of my kind of mentors from GLADA, Dr. David Berry and Daryl Conway, so one's from Saginaw Valley State and Daryl is from University of Michigan. They both heavily believe in practicing emergency skills in realistic situations. So I know that Daryl has talked about at GLADA that he sometimes will have his entire staff, if it's raining outside, okay, go get your rain gear, we're going outside, we're going to spine board. So just kind of practicing things that are not normal when we practice. Usually we practice in a facility controlled environment on kind of a hardwood ground, but we don't really ever practice on things that our patients could realistically be on, as pole vaulter, high jumper, football player in September in the Midwest, especially where it seems like it always rains in September. Just really making sure that we're continuing to review these skills is important, but just doing it in a way that you're gonna feel is more realistic than just facility controlled environments. So it was a really kind of meaningful conversation about what that would look like in the basketball setting. So interesting enough, it would really look more like what we normally do, but what that would look like throughout athletics training services at Indiana State and what each kind of place would have to do that. It was really a good conversation about what we should be doing as athletic training kind of staff and services, and what kind of doesn't actually happen in practicality. And then the final thing that I want to talk about is that part of my goal for this semester, and that I've conveyed to Connor, is to fill in all the gaps in kind of my education. So for me, that looks more like organization and administration help. So with that being said, Connor's kind of developed this cool little plan for both of us to go through the P&P for Indiana State and suggest changes for Kellen and a potential new hire for Kellen, whoever would take Cody's position, to review our suggestions and make changes accordingly. Obviously, we've already looked at the EAP for the Holman Center, and there's things that need to be changed, especially now that Kellen seems to be the Director of Athletic Training Services. So I'm really excited for that. Not only does that really kind of give me another good mentor and start off in a good relationship with Kellen in the last couple months that I'm there, but it really kind of will gap, in my opinion, what organization and administration looks like in the classroom setting versus what it looks like in the athletic training setting. So this has been my reflection for the last couple days at my clinical site, and I look forward to updating you in the next 3 weeks. I would assume that the data tables for our honors thesis is close to $20,000 when we end the collection period, which will be ended in the next 3 weeks, and I'll begin to write and review my honors thesis. So I'm looking forward to updating you and giving you the final number on what our worth as athletic trainers would be for men's